topic is the HPV vaccination, Gardasil in specific. This vaccination has brought up many controversial questions and concerns in the general public and parents. Tonight we have some guests on the show to help clarify those questions and debunk some of the myths associated with the vaccine. First we have Graham, a representative from Merck, the pharmaceutical company that manufactures Gardasil. We also have Kevin, a representative from the Public Health Agency in Canada. And we have Jillian, a physician from the Federation of Medical Women in Canada. So first off, what is Gardasil?
Gardasil is a vaccine developed by Merck, and it was developed to primarily prevent any associated infection and illnesses from HPV virus. Our research has shown that of 22 different types of viruses, 4 specifically are associated with the most common conditions such as cervical cancer, head and throat cancers, etc. So by developing this vaccine, we are actually reducing large numbers of related conditions from HPV just by preventing these 4 types of viruses from affecting the body.
So currently in Ontario, there are programs that will fund the vaccine for girls grades 8 to 12. Are there similar programs in other provinces?
Yes, all provinces have taken on the kind of mentality that this is a program that needs to be supported by prevention elements. And so every province has introduced a program to vaccinate girls between the ages of 9 and 17. All throughout.
So some parents refuse to give the vaccination to their kids at such a young age, as Kevin said, ages 9 to 17 in Canada for girls. What are some of their reasons for not wanting to vaccinate their children at these young ages?
Well, there is a belief among parents that this vaccine will increase promiscuity in their teen, and this is mainly of concern because most of these kids are getting the vaccine before they're sexually active. There is no proof that, in fact, it does increase the promiscuity in these kids. However, there is concern that because this is a vaccine that prevents the STI, kids will be less likely to practice safe sex.
Okay, so Kevin, earlier you said that every province in Canada has some sort of program in place to fund the vaccine. What are some of the differences between the provincial programs?
Yes, each province really takes its own spin on the program. Notable ones are provinces such as PEI, who actually just last year in April started vaccinating the grade 6 boys with the Gardasil vaccine. Also, we have Alberta, which as of this September 2014 will also be introducing a similar program. Quebec is another one that has a different take on it. They vaccinate women who are HIV positive and under 26 to help them out because they have the compromised aspect of it. So they take kind of more that spin.
So you mentioned that some programs are starting to introduce the vaccination into boys. Are there any negative side effects associated with the introduction of the vaccine to males?
Now, studies have shown that the safety profile for the vaccine between males and females don't show a difference. Some of the side effects for it might be a mild fever or pain at the injection sites, nothing dangerous or life-threatening. However, it tends to be more related to females, just because of the high success rate with the cervical cancer. However, it does help prevent HPV infections in males, such as penile, throat cancer, genital warts, things like that.
Okay, so who's responsible for the creation and implementation of Gardasil?
So Merck developed the vaccine, but we did so with a variety of partnerships. Our biggest partners have been governments worldwide. We originally developed this vaccine to cover large numbers of people in all countries. So because of this, there was actually a fast-track process of developing the vaccine. This means that the creation and development and testing was all accelerated. Now that doesn't mean it's any less effective or safe, it just means that the rigorous testing that's involved is done very condensed so that we can get this vaccine out to as many people as possible and as soon as time as possible. We found that with all of our countries that we've developed the vaccine and distribute them to, we've had huge success rates, and 70% or higher in most cases. So the most effective way to do this is to work with the government and work with the local health agencies to make sure that all of the population is able to get a proper vaccination program.
So is this vaccine medically necessary, or was it designed with a financial goal in mind?
Well, Merck is always committed, number one, to the public health. And we've actually, if you look at some of the programs we have going, countries such as the United States that doesn't have as comprehensive of a program that Canada does, we've spent many millions of dollars distributing the vaccine for free to adults and children who cannot afford it. So our goal is always to make sure that people are healthy, and we really wanted to see this vaccine take off in all countries, and we're doing everything we can to make sure that it gets out and has the life-saving properties that we designed it to have.
So that's all the time we have for tonight. Thank you to all of our guests for coming in and sharing that information with us, and we'll see you guys next time.